Thanks very much, everybody. Aloha. I'm very happy to be here today with this bill. I'm looking around the room, and there's a couple of people, at least I'm looking at Bob right at the moment now, who remember back this far, just in connection with long-term care as such, over and above the particulars of this bill today. Back when I was Health and Human Services Chair in the state Senate in the last century, the question of long-term care began to bubble up as an issue, particularly around Medicaid issue, the federal dollars and the state relationship to it in the wake of Medicaid and Medicare being established at all in post-Lyndon Johnson. And I remember I put forward with Stan Snodgrass at the time, who'd been one of the pioneers in healthcare association, long-term care activities. At his behest, he came in to see me about putting forward the idea of long-term care insurance and to put forward the idea to the legislature of long-term care insurance in terms of a tax credit or some kind of recognition by the state of companies that would put long-term care insurance forward as one of their a part of a benefits package that they might engage in bargaining with their employees, or if the state itself could do that, and perhaps private employers too receive some kind of a credit or recognition in some positive form, some incentive form, to offer long-term care insurance as a benefit. It failed in the legislature. The argument against it at the time is that it would cost the Treasury money, cost the general fund money in the end if you began to give credits to businesses who put this forward. And I thought, of all the short-term thinking, this was at a time, and everybody in this room can certainly appreciate it today, when we had a surplus in the Medicaid trust fund. Can you imagine? I mean, there's legislators, Susie's shaking her head, and Ryan and Joe are even more, are more closer in time to today. But Susie, remember that in fact, probably when you came in, Susie, there was no surplus in Medicaid, but there actually was in that time, in the mid-'80s, there was actually a surplus in it. So I just cite that anecdote to you to say that people like Bob understand that some of us were trying to look ahead at that time as to what was upon us. And the argument that Stan Snodgrass and myself made at that time is that the population was aging, that the term seniors would be an anachronism fairly soon, and that we, at the time, I don't know whether we coined this phrase or not, Bob, you'd have to say, we began to talk about the aging elderly, and that this would be a phenomenon, a social, a cultural, an economic phenomenon that we would have to come to grips with, and that the likelihood of per capita of Hawaii, the state of Hawaii, being among the leaders in those categories. More people living longer, more people aging in place, and that population growing. Not only living longer, but growing in numbers as well. And that would have these profound implications. So that brings us up to today. And with regard to long-term care facilities and the sustainability fees, which without going into a whole detailed explication on it, essentially is a fee paid by entities, hospital sustainability fund, long nursing facility sustainability fee into a fund. And in return, that can be leveraged. That amount of money can be leveraged in federal dollars, and again, without going into all the torturous details of it, into a sum of money then that will in effect guarantee 100% return of the original fee, and a sum of money then that is available to the state. The idea being that if we could work a formula that would allow the state to meet its obligations that it was otherwise having difficulty meeting for the poorest of the poor, that we would then share that with the long-term care facilities. And I want to credit the folks associated with that understanding right away. I've mentioned Bob several times already. Bob, I'd like you to stand up and just to be recognized in terms of understanding all these years. Thank you. There are others, I don't necessarily all have to come forward or anything, but Emmett White and Richard Kashiba, associated with the Long-Term Care Association, absolutely terrific in that. Thank you very much. With the administration in this regard, Pat McManaman and Barbara Yamashita, Brian Pang, Leslie Tawada, and Susan Yamamoto. Not all can be here today, but the idea is this, and I'll move forward with this. There's a very simple proposition that I operate with. Easy to say, not always easy to implement, but I think it's easily comprehensible. Everybody has a special interest or a multiplicity of special interests. Every institution does. Long-Term Care Association does. Pat's Department of Human Services does. I do. The legislature does. The question is, and that's what this democracy is made up of. When you go back to the Federalist Papers, Madison and the others called it factions, that we would have factions, that there would be different approaches to what the interests were, and they would come in hopefully in positive clash, if you will, positive meeting with one another. So everybody has their special interest. The only question is does your special interest and the public interest coincide? If that happens, that should be advocated for and joined together. If your special interest becomes a private interest at the expense of the public interest, then that has to be resisted. It has to be contended with. And in this instance, the Long-Term Care Association saw instantly that its interest, its special interest, and the special interests of Pat and the Department of Human Services and the programs, divisions that were under our charge and responsibility in the wake of the recession needed a portion of those funds, those leverage funds, to come to the state. And they not only understood that, they recognized it instantly. We came to an understanding very, very quickly as to what the interests of the state were, what the interests of the Long-Term Care Association were. And as a result, we're going to have this signing today where everybody is winning because the public interest is being served by all sides. And I'm very grateful for that. Done. Very good. Yeah, before we take holy pictures, I'd be happy to answer any questions.
Why sign this bill but put on your veto list an almost identical bill that would provide the similar fee and federal match for private hospitals?
Those are different circumstances.
Well, what would be different about it? Do they not, because the hospitals wouldn't agree to a 12% share for the state?
Well, as I said, you've got special interests and the public interest, and when they coincide, why, that's a happy day.
When there were 47 other states, including D.C., that had already enacted this, why is it that it took us this long to get to this policy change?
Oh, I just got elected.
Okay, I think we're ready for photos.
Okay.